Was it unique to like a Western healthcare system, like specifically the States? Or would you say it's kind of a problem with modern medicine in general, where the basic mentality of it is we got a we got a one size fits all kind of policy. If you're not dying, don't waste my time.
Yes, very much so. One size fits all protocols, and not a holistic approach at all. So I had this conversation with my gastroenterologist when I was suffering with ulcerative colitis in my 20s. He wanted me to go on escalating more and more stronger medications, including injections with biologics. And I looked at him. I love my gastroenterologist, but he's trained in a certain way of treating people. So I looked at him and I said, I am not going to do that. I am going to investigate other ways to manage this disease. And so through through changing my health behaviors, I've been able to stay flare-free from ulcerative colitis for as long as 7 years. I've healed back pain. I've lost 30 pounds. I no longer suffer from anxiety. And it's not rocket science what I do. It's just basically taking care of the body.
But the thing is, Becky, a lot of people would have just stopped at that. They would have like kind of experienced like all the benefits for themselves. They would have improved their life, and that's great, of course. But you took it a step further because now you're trying to do that for other people. I want to
Yes.
ask, number one, do you see a big need for what you do? Like, is the demand out there? And number
Yeah.
two, what pushed you to do this for others?
So we had talked a little bit before the show about having an entrepreneurial spirit. And so some of my motivation for opening the business has been I truly get excited when I see someone shifting just little bits of their lifestyle and it's causing a dramatic improvement in their health. I truly am thrilled when that happens. And the other side of it is I do believe that I'm a little bit of a risk taker, and I think that we need to take more risks in health and healthcare in order to actually solve problems. And so I do believe I have that entrepreneurial spirit as well.
Right. And I want to go back to those problems you talked about. What is wrong with the healthcare system right now? Because as you said, in your specific case, they tried to just give you pills and pills with their own
Yeah.
side effects. And then once you have those side effects, they give you more pills with all these other side effects. And then you end up with like, the box
Hmm.
with your daily pills. When I was a
Uh-huh.
kid, I called it candy,
Oh
you
my
know,
God. Yeah.
always exploring grandma's closet for those colorful pills.
Oh God. Yeah.
Listen, if
Yeah.
they don't want kids eating them, they shouldn't make it look so good. I'm
That's
just
true.
saying.
Some of them have sugar.
Yeah, yeah, I remember. I mean, yeah, in theory. But yeah, like, what's the issue? Because like you talked about your doctor, your
Mhm.
gastroenterologist, and we
Yeah.
all know a bunch of doctors out there. They're not evil people. I
Right.
don't think they're lazy people. Some
No.
might be. I don't think most are. But then what's the problem? Why is it that they're so set in their ways, in their specific specialty, that they can't consider the possibility of anything else? Because I'll get into it a bit more later, but I've also been through the. I've had
Yeah.
some back issues, which affected my left leg. I couldn't move that leg.
Yeah.
It's not that I couldn't feel it. I could completely feel the pain I was going through, but I couldn't really
Mhm.
shift that leg. And then we went to a bunch of different specialists who recommended everything from like invasive surgery to silicone injections in my lower spine. And now I'm moving due to physiotherapy.
Yeah.
No medication, no injections, no surgery.
Yeah. 100%.
So,
Yeah.
what keeps these doctors so rigid?
Yeah. So, what's wrong with the healthcare system is a big, 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 big question that has many different layers to it. I'm in a master's of health leadership program that's addressing so many problems that we have in our healthcare system. Um, so, in that case, my doctor, a lot of doctors, a lot of nurses are afraid to leave the beaten path because they're afraid that they're going to be sued. There's an awful lot of fear in the culture of healthcare. And so, unless something has been studied and then studied again and then studied again and then studied again and confirmed by insurance companies to be valid, doctors won't go for it. So, for example, health coaching is a rather new way of treating people. But because it's so new, most of the time, insurance companies will not reimburse for it because it has not been studied for long enough term. So I think some of it is fear of getting into trouble, making the wrong call, getting sued. I think most of it is that. And also, I'll say lack of time. We perceive in healthcare that we don't have time to actually sit down and talk to people. We perceive that to be inefficient use of resources. And I can tell you that every single time I've taken the time to talk to a patient or family member about what was actually going on with them, the results have been fantastic. So I'm thinking specifically in the case of talking to a family member when their loved one is in the ICU and there's nothing more we can do, and it's now time to have a conversation that we need to let them go. So I'm thinking specifically of that scenario when I'm talking right now.
Is that why also like nurses are really important? They talk like humans.
Right. So we are the liaison between the doctor and the patient.
The
We
PR.
do, what?
The PR.
Yeah. So we help the patient, the family member, understand what it is that the doctor just said, the plan of care. We listen to them, and then we bring concerns back to the doctor. But I would say it's also very beneficial for the doctor to just slow down and have the conversation directly.
Yeah, it's definitely something I can agree with because I think there is a difference between the system in Canada and the system in the States.
Mhm.
There's a lot of similar problems, but I know a massive problem in Canada is you just don't see a doctor. There's not
Mhm.
enough on a public healthcare system, and it's like Canadians, including I'm Canadian, but a
Mhm.
lot of other Canadians who grew up here who haven't really experienced other systems in the world, especially private healthcare, they'll
Mhm.
go on and on about how like it's amazing because it's free. It's like,
Yeah.
okay, it's free, but they keep cutting the budget every year. And
Mhm.
we basically have like people like bringing a pillow to the waiting room because it takes 13 hours to see a doctor. So they sleep there. And
Mhm.
then once you see a doctor, it's as you said, they're rushed.
Mm.
They're
Yeah.
they're probably sleep deprived. They've got to see a
Yeah.
ton of other patients who are okay. Maybe you're there because you are dying, but they have people who are dying much quicker than you.
Right.
And then like their mind is all over the place, and you have to remember they're stuck in their specialty.
Right. 100%. Yeah.
So like as I said, like there's been many cases where like a doctor comes in looking fried because he probably hasn't slept or she hasn't slept.
Mhm.
And again, it was the nurses that kind of were the
Mhm.
mediators and calming factors. Because if I talk to that
Mhm.
doctor, he's not taking in any information. He's not in
Right.
the mindset of that. But if I talk to the nurse, usually they have a way to translate to the doctor what's going on, and then you get a better outcome.
Mhm.